Now, a few things about this oral health care initiative should be obvious. One, this effort will have a lot of partners on the state, local, and federal levels. That's appropriate given the systematic nature of the problem, and it will increase our chances of success. I want to acknowledge the hard work of our people at the Department for Local Government in helping to prepare the grant applications and in working with ARC to secure funding. I want to thank our congressional delegation for making sure that ARC is awarded funds. I want to thank individuals in the private sector, such as Al Smith, and I believe Al is here today, and others who have drawn attention to the systemic problem that we have in this state with oral hygiene and oral health. The second thing that should be obvious is that this problem will not be eradicated overnight. However, we do anticipate and expect to make measurable progress with this program. Thus, we have set some specific goals. For example, within 3 years of the start of the project, we expect to increase the number of dental visits by children up to 6 years old by 16%, as measured by Medicaid service reports. We also want to reduce the decay rate by 15% in children in the distressed counties. Finally, it should be obvious that this isn't just a dental program. It's a health program. Teeth aren't just for looks, and good oral health isn't just cosmetic. It's a key factor to overall health. Poor dental health has impact far beyond lack of a pretty smile. Studies show children with untreated pain and infection because of tooth decay often choose other foods, affecting their overall nutrition. They also can have poor speech development, and they have lower performance in school. You can't learn under those conditions, especially when you miss school. This program supports one of my highest priorities as governor, getting our children off to a good start in life. Previously, we began work on a program to bring health insurance to the tens of thousands of children whose families don't have any. Already, more than 25,000 additional children previously uncovered have been signed on to Medicaid or K-CHIP, and that number continues to grow. We've also created a task force to streamline our network of early childhood education and health services. The simple fact is we owe our children the promise of a productive life. Making good on that promise is a moral obligation, but it also will pay great dividends to creating a much stronger state. We have severe financial challenges in state government, just like every state does. But a down economy is no excuse. We must fight for our families. We must improve the lives of Kentuckians. We must move forward on fundamental problems that have been holding us back. Now, these children in front of me here are from West Ridge Elementary here in Frankfort. And you're in the first grade? How many are 6 years old? One? How many are 5 years old? Oh, so is this kindergarten and the first grade? Okay. How many of you brushed your teeth this morning before you went to school? Okay. All right. How many brush your teeth regularly every day? Good. How many of you have ever had a cavity? Uh-huh. How many of you have ever gone to the dentist? How many of you think it's fun to go to the dentist?
A little bit.
A little bit. I like that. Well, I want to thank you all for being here today. You know, these kids here aren't a part of this initial effort, and thankfully, they don't need to be. But this is a problem that impacts all of Kentucky, and not just simply one region or place. If we're successful with this effort in Eastern Kentucky, my hope is that we will be able to find ways to replicate it across our state so that one day the stereotype that plagues Kentucky is no longer even remembered. Thank you all very much for coming and being with us.